Hi, I'm Dr. Melanie Palm, and in this little mini-series, we're actually going to be injecting the tear troughs with a product called Perlane. Both Perlane and Restylane are part of the Restylane family, which are hyaluronic acid fillers, and we commonly use this to treat tear trough deformities, which is that sort of loss of volume along the area where the lower eyelid and the cheek junction are. And often people start to hollow outside here in the lateral eye area. So what you'll see in a few seconds here is a patient very comfortable, actually depositing a little bit of the product right on top of the bone in an area called the supraperiosteal space. And that's going to elevate that soft tissue and give a really nice contour and a loss of that demarcation line between the lower eyelid and the cheek area. Okay, we'll get started. So you're going to feel a little pinch. Tiny bump. We're just putting the smallest amount of filler right there. Little bump again. Feeling for the bone. Perfect. And open your eyes for me for a second. And close. Little pinch again on 3. 1, 2, 3. I'm just kind of marching along that space. Perfect. Little pinch on 3. 1, 2, 3. And this seems like a very delicate area to fill. You know, it's something that scares a lot of patients when we first talk to it, but people are quite comfortable when we do this. This is a lot simpler than filling the lips. I think the comfort level is similar to filling the nasolabial folds. So we're going to march out here. See, she's got good tissue volume, but just the slightest hint of a little bit of volume loss. So we're just going to put a pinch out here on 3. 1, 2, 3. Marching along to the side. Good. And we're done with that side. You can compare it to the other. You can notice that there's tear trough deformity here we have yet to fill. So right in here there's some volume loss. And we'll also put just a touch out here as well. But you can see she's had very little bleeding, no bruising with this. It's so important. We at the clinic give patients a medications precaution list, things to avoid. There's lots of teeny vessels in this area that we want to be careful of, and inevitably sometimes you get near one and can get a little bit of bruise, so we counsel patients that a bruise is always possible, but usually we get quite lucky. So I'm going to come over to the other side, and now we're going to do the left side. We're going to start the same way, start from the middle portion and work our way over. So a little pinch on 3. 1, 2, 3. Pinch again. Pinch again. 1, 2, 3. 2, 3. So we're just marching along what we call the orbit, which is just sort of the bony landmark around the eye. And I'm depositing small amounts of the Perlane just right on top of it, and that allows really nice, even volumizing of this area. Pinch. And with that, we're done. You can see that was quick and painless and little downtime. There is a little bruise. It's usually very easily covered by a little camouflage makeup. I do counsel patients that the area can get swollen. The product, whether it's Restylane or whether it's Perlane, is sort of water loving. So the next couple days there can be a little swelling in the area, although most patients do fantastic. It's sometimes nice to avoid really salty foods, sometimes sleep with an extra pillow so you have a little bit of head elevation the first couple days. But patients do fantastic, and we usually see them back in a week. And it's a really nice area to deposit the filler because it seems to stick around a little bit and really helps give a youthful appearance to the face. Have a great day.